started phlebotomy, right? We started the process of taking blood. What's phlebotomy? Phlebotomy is bloodletting, to get the blood from the veins of the patient. Why you don't take the blood from arteries, you take it from veins, right? Are you allowed to take blood from arteries? The answer is no. You're not allowed to take blood from arteries. You just take it from veins. When you choose a vein to take the blood, how to recognize when you look at the skin of the patient, underneath the skin there are blood vessels, right? How do you know this is artery or vein? The artery located deeper. You don't see the arteries. All the blood vessels you see underneath the skin, subcutaneous vessels, they are all veins. That is why you're taking the blood from the veins. Again, the circulation of the heart. Let me make a quick review for the circulation. Systemic circulation. Here is the systemic circulation. This is a diagram for the heart. The heart having 4 chambers, 2 atria and 2 ventricles. The atria is the plural form of atrium. This is right atrium, left atrium, both atria located on the top, and right ventricle, left ventricle, both ventricles located in the bottom of the heart. Okay. Talking about the heart, we're talking about the right side of the heart and left side of the heart. The right side of the heart having different color here on the diagram, not on real, just in diagram. It takes the blue color here because it deals with deoxygenated blood. Deoxygenated blood. Oxygenated, oxygen means oxygen, right? Oxygen. Oxygenated. This suffix means pertaining to. D means no or lack. Lack of oxygen. Lack of oxygen. So the right side of blood, right side of the heart deal with the deoxygenated blood, with the blood lack of oxygen. The right atrium receives deoxygenated blood through 2 big veins. The biggest vein in the body, superior and inferior vena cava. Vena cava. Superior and inferior vena cava. Deoxygenated blood coming from all over the body, and the superior vena cava draw blood from level above the heart, and the inferior vena cava bring the blood to the heart from the level below the heart. This deoxygenated blood, it pours here in the right atrium, then through tricuspid valve to the right ventricle. We studied that last week, right? We just reviewed. Through tricuspid valve to the right ventricle, then through pulmonary semilunar valve to the pulmonary arteries to both sides, to both lungs, right and left lung, where it is oxygenated in the lung. When it's oxygenated, it returns back to the left side of the heart. Right atrium, and then through mitral valve to the right ventricle, through pulmonary semilunar valve, through the aortic semilunar valve to the aorta to all over the body. Here, when you look at this diagram, you find this. The heart receives deoxygenated blood in the right side of the heart, but the left side receives blood from the lung, oxygenated blood already, right? To pump it all over the body. Any questions so far? Very good. Arising from the left ventricle is the aorta, where the semilunar aortic valve is here. If you have any question, just ask me. Don't ask your friend. Okay? Very good. If you look at the heart here, the aorta arises from the left ventricle and driving the oxygenated blood all over the body through this big vessel, the biggest vessel. Here, this is one point I want to tell you. There are a lot of blood vessels in the body, but when the blood vessel is closer to the heart, it's bigger. When it goes further away from the heart, it becomes smaller and smaller and smaller. Okay? Very good. So you can recognize that these blood vessels are the biggest blood vessels in the body. The artery is the biggest artery. The vena cava here, superior and inferior vena cava, are the biggest veins in the body. Okay? Very good. When you look at the artery here, you find the artery is taking this arch, the aorta is taking this arch, and it having like three parts. This part is called the ascending aorta, and then arch of the aorta, and descending aorta. Okay? That is the aorta. From the ascending aorta here, the circulation, the first branches coming out of the ascending aorta is called the coronary arteries, to bring oxygenated blood to the cardiac myocardium, or the cardiac muscles. For the muscles of the heart to find the oxygen and nutrient, they find that they receive that through the coronary circulation. And then from the arch of the aorta here, it goes two big branches here, carotid arteries, right and left carotid arteries, to supply blood to your head and neck, all the structure in the head and neck, and the brain. You have brain?
Yeah.
Is your brain receiving enough blood? Have to make sure that your brain receiving enough blood. If you feel the carotid artery, you find enough palpation of the carotid artery, that means enough blood going to the brain, right? Very good. It's also aorta supply blood to the upper limbs. Yes, it supply blood to the upper limbs through artery here, and another artery going to the right limb. This artery takes different names, but you have to know the name on the arm. I'm not going to ask you the name of this artery on the neck here or in the upper part of the chest before it goes to the arm. But once it goes to the arm, you have to know the name of this artery, because we using this artery for purposes, many purposes. When you measure the blood pressure, you're using this artery. Also, when you count the pulse rate, you're using this artery. So you have to know the name of this artery. Okay? Let me give you another diagram here. What is this? The arm, right? That is the arm. Very good. When this artery enters the arm here, it goes this way, and then it divides into two branches. This branch here is called the radial artery, where you check the pulse. When you check the pulse using the radial artery, you press the radial artery against the radius bone, and you feel the pulsation of the artery. Okay? But I'm talking about the artery here. This artery is brachial, it's called brachial artery. Brachial artery. So the artery brings oxygenated blood. Brachial artery brings oxygenated blood to all these structures here, bone, muscles, skin, and fat of the body, of the upper limb. When it supplies oxygen and nutrients, and the blood return back to the heart, are deoxygenated in the form of two veins. In medical terminology, you studied that when the vein is closer to the body, it's called the medial. Outside it's called lateral. But here, we call this vein is called the basilic vein. And this is called cephalic vein. And this area here, this area is called antecubital fossa. The whole area is called antecubital fossa. And this is the first choice to draw the blood. What is the first choice to draw blood? Antecubital fossa. Could be basilic vein, cephalic vein, right? We have another vein connecting these two veins together at the same fossa here, at the antecubital fossa. It's called median cubital vein. Median cubital vein. This is and that is the first choice for blood drawing. Antecubital fossa. When I ask you a question, what is the first choice? What the first site of choice to draw blood? Antecubital fossa. Which vein in antecubital fossa? You say basilic, cephalic, median cubital vein. Okay? Very good. Sometimes you find these veins are hard to find. not every patient having the same appearance or the same size of the vein. Are you allowed to take blood from a different area?
Yeah.
The answer is yes. Where? Which vein? You can choose the wrist, at the wrist, or the dorsum of the hand. But this is the first choice. Very good. The second question is, are you allowed to take blood from foot, from the lower limb? You can, but after permission. After permission. Very good. Why do you have to take permission? Because complications could happen. When you use the leg veins, complications could happen in the form of phlebitis or thrombophlebitis. Itis means what? What's itis mean? Suffix itis. Inflammation. Phlebo means vein. Inflammation of the vein. That is a complication. So thrombophlebitis means inflammation on the top of thrombus formation, or thrombus formation on the top of the inflamed veins. Is that clear? Very good. Are you allowed to take blood from arteries? The answer is no. You're not allowed to take blood from arteries, just from veins. Okay? Very good. We studied that last week. Sure. Okay. This week, we need to study the technique, how to draw blood from the patients. To be medical assistant, is it enough to be medical assistant to draw blood from the patient? No, you have to be skilled and a professional. Okay, very good. Because not all the patients are cooperative. Some patients, we call it hard patient, they are not cooperate or comply with the procedures. So you need your reactivity, your professional way to calm him down, and you have him to be high, have him to be cooperative. Okay? Very good.
Morning, sorry to be
Hi,
late.
good
I had an
afternoon.
appointment in my daughter's school this morning. I thought I'd have been finished by now because it starts at 8
We
o'clock.
started. We just started. We made a review for the last week, and we're gonna start for this week here. Okay. Everyone has their phone? Very good. Today we study the techniques, how to draw blood from the patients. To start to practice the technique, you're gonna use some stuff like the needle, like the vacuum tube. The vacuum tube called vacutainer. Vacutainer means vacuum tube, okay? And other stuff. What do you need to draw blood? Last time we studied the syringe, right? Are you okay? Are you here? We studied the syringe last week. You wasn't here last week.
Yeah.
These are parts of the needle, of the syringe. This part of the syringe is called what? Barrel. Plunger. And here is stopper. And that is the needle. It's formed of hub, shaft, and bevel. All this is called the needle. These are the parts of the syringe. We used to use a syringe. It comes in different sizes, and it used to be in a glass. It's made of glasses, and we used to boil it and reuse it. But now, because we have a plastic syringe, so it is disposable now. Used to use the needle to draw blood. That was before they do the vacutainer or the vacuum system. The vacuum system is a closed system. Now we don't use the syringe anymore to draw blood. So do we still have a needles, a syringe? Yes, but for what purpose? To give injections, just to give injections, not to draw blood. So to draw blood, what do you use it?
What was the end called? A what? Plunger?
Plunger. To draw blood here, we use what's called the holder. And also the needle. The needle here is different. The needle having two sharp ends here. One is long and the other side is a shorter.
Short.
The short side here is covered by rubber sleeve. That is a needle. Needle holder and the tube. That is the tube. The tube is vacuum, and that is the secret. That is the secret. Vacuum means the pressure inside here is very low pressure because they evacuate it from air. Vacuum, no air inside. Okay? So when you take the air out, actually you're creating a negative pressure here. So when you're using this system, look, you're using the needle inside the vein. And then the blood runs through the needle to the tube inside here. Why? Because the pressure in the vein is higher than the tube, and the fluid moves from high pressure to a low pressure until the tube is filled, 2/3 of the tube, and the pressure will be equal, and the blood stops by itself. Okay? When you put this tube, the needle, in the holder, and this is the hub, and that is the needle. and the inside part is covered by rubber sleeve. Gonna be this way here. I'll show you practically how to do it, and you will do it yourself. And you start, when you put the the needle inside the vein, just make sure the bevel is up. Before you're using the needle, make sure the bevel is facing up, right? Very good. And then you started to press the tube here, press it here. When you press the tube here, this rubber sleeve will be shrink, taking this and this position, and the tube will be here. Because you're pushing the rubber sleeve inside, right? Now the inside of the tube is connected to what? To the vein. And the pressure here is higher. So the blood will draw from here to here. When you finish, the blood stops here and the blood is full of blood. You start to draw the tube out, right? Very good. When you take the tube out, what happens?
The needle covers back up.
Yeah. When you take the tube out, full of blood, and the rubber sleeve doesn't have any pressure here, so it's expand back and to cover the needle so no bleeding happen. That clear? And that is a system, and this having the advantage of the syringe, because here you can take as many as you want. How many samples you want it? Okay? 2 samples, 3, 5. You can just remove the tube, put the next tube, remove the tube, put the next. But when you use a syringe, when it's full, it's done. You have to draw the needle, withdraw the needle, and if you need another tube, you poke the patient again.
To be at 5.
How about if you have 5 tubes?
You poke the patient 5
times. So this is having advantage on the other
How do
side.
they make the the rubber on top of the tube that it don't have a puncture? Is a special rubber? You know, on top of the cylinders, you know that rubber?
Rubber, eh?
And you know
it's
the-
called
the-
tourniquet.
Okay,
It's
you
called
know.
tourniquet.
Yeah.
What's the problem?
No, I wanted to know how come it doesn't puncture, like, you know, the needle goes into it and, you know, fills it up. How come it don't have that hole on top of it? Do they, it sucks it up, it closes back up?
We
The
don't
end
have
here.
we don't have a hole on the top of what? Of the tourniquet?
Like this, yeah. This is what I mean, like this. You know when we fill it up, right?
Yes.
The needle goes into it.
Yes.
How
Yeah.
come on top of here don't we?
This is called the stopper.
Yeah,
When you
it-
talk
no
to me,
air.
just try to use right. This is a stopper. When the needle goes here, this is rubber also.
Mm-hmm.
So when you take the needle out, this rubber is elastic. It closes again.
Okay.
Close by
It
itself.
closes back by itself.
It doesn't.
Okay.
It doesn't remain open like this. It's elastic.
Oh, it goes back. That's why I wanted to know.
It
how-
closes by itself.
Yeah.
Okay. Look. When she asking question and she want to know, she gives me a good message. And when she called me in the morning, I said, yeah, who's calling? She said, I'm your baby. Okay. That easy?
Yeah.
That clear, right?
Mhm.
Very good. What is the name of this evacuated tube? Vacutainer.
Okay.
Vacutainer. And here is a technique. The technique. That is the hand of the patient. You have to remember, before you do phlebotomy, make sure you correct anything before you start the procedure. Number one, some tests it need to be done when the patient is fasting. So if the test needs fasting the patient to fast, ask the patient if the patient is fasting. And this is the proper question for the patient is fasting, because fasting related to religion, different religions, they fast different ways, okay? So if you ask the patient, are you fasting? This is not the proper questions, okay? Because some people, when they fast, they eat any time, but special food, okay? But the proper question is to ask the patient, when is the last time did you eat? Last night means 6 to 8 hours passed already, so he's fasting. Is that clear?
Yeah.
Very good. How about if you ask the patient, when is the last time did you eat? And said, yeah, today, this morning, I took my breakfast. And the test is recommended to the patient to be fasting. What to do?
I mean, you can't take the blood.
You can't take the blood, it's useless.
Yeah.
For this test, it's useless. So what to do? You call your supervisor. You have to inform your supervisor and ask the patient. Supervisor will tell you, okay, just inform the patient to be fasting tomorrow, next day. And we repeat we'll do the procedure next day. Is that clear?
Yeah.
Very good. As we studied here, how many veins do we have here? Can you remind me?
3.
What is the name of this fossa? Antecubital fossa.
Yeah.
Or you can say antecubital region.
1.
Good night.
I'm sorry.
Good night.
I'm sorry.
But look, it's nice uniform.
Oh my
Look,
gosh.
yeah, extra credit.